For the next part of the ear exam, evaluate the patient's hearing. Occlude one of the patient's ears with your finger. Test the open ear by softly whispering numbers or words with two equally accented syllables from 1 or 2 feet away. Test one ear at a time. If hearing loss is present, gradually increase your voice volume until the patient can identify the spoken numbers or words. If hearing is diminished, do the Weber test, which checks for lateralization of bone conduction, and the Rinne test, which compares air and bone conduction. For each test, use a relatively high-pitched tuning fork, such as one of 512 Hertz. To do the Weber test, place a lightly vibrating tuning fork firmly on top of the patient's head. Ask where the patient hears the sound, normally in both ears or the midline. To do the Rinne test, place a lightly vibrating tuning fork on the mastoid bone behind the ear. When the patient indicates that the sound is no longer heard, quickly place the vibrating fork close to the ear canal. Normally, the patient can hear vibration longer through air than through bone.
Can you hear this?
Repeat the test on the other ear.
Tell me when it stops.